For wound closure, I know everybody talks about suturing, but I prefer staple. And the reason why I prefer staple is the technique. It's much easier to learn. There's less complication, not less complication, but much easier to do. You don't need to freeze as much as you do to do suturing. It's much easier to teach, again, people with not a lot of medical training, and pretty much uh, easier to carry as well. You don't need to carry different kinds and things like that. For bigger wounds, closure is not so much recommended, especially if you're not that much of a that healthcare professional, because if you're starting to talk about closing fat or muscles or things like that, so if you have a wound that is that deep, dressing would be much appropriate. I injured myself once over here and didn't have any suture, and just use some gel and some dressing change, and my wound closed pretty good. I do have a scar, but beside having any scar that you can have left, the wound will still close and the skin is still pretty strong and everything. So instead of suturing, I would recommend more the staple. Easier to learn and easier to use as well. A little bit cheaper, I think, as well as suture, because for suture you need suture kits, you need anesthesiology, you need some freezing drain, you need some syringe. So just with this now, I can pretty much take care of wounds, as well as in the middle of a field or in a situation where we need to get out of the situation pretty quickly. This can close very rapidly and control a little bit of bleeding, especially for the scalp. And the helicopter surface where I work, that's where we carry, in case that we need to close some scalp laceration in the middle of nowhere. So I much prefer staple over, although they're not for every wounds, and just see the links below. But I believe this would be a much better choice than suture.